week simply because of the high volume of testing that was being demanded at our Carolyn Center was causing actually a safety concern with traffic flow backing up onto Ulmerton Road. So this site, while it may be a little further south in the county, is still readily accessible from the Interstate 275 and gives us the ability, because of this large open space, to offer testing to even more people to meet the demand of the community. I'll take questions.
Can you talk about the amount of tests that are going to be available every day and who will be eligible to get them?
Thank you, great question. Testing every day, the people that are eligible for testing are anyone with a physician's prescription, anyone that has the current symptoms or criteria by the Centers for Disease Control to indicate that they are symptomatic and they need testing, or they had a significant exposure. As to the number of tests that we will be conducting every day, Baycare has a finite supply of testing materials that we must use in our intensive care units, our surgery centers, our emergency rooms, our hospitals, our ambulatory sites, and these drive-through testing locations. So it's almost a dance every single day of trying to leverage all of the supplies we have up to a certain maximum amount to meet all the demand for testing that exists. But on any given day, if we don't have the supplies to do the test, then we have to cease doing the testing for that day. Baycare has been very coordinated and mindful and thoughtful in partnership with the Pinellas County Department of Health to secure a reliable supply of testing materials. Thank you.
We were told earlier, Representative was told us that there are 315 tests are available today.
Yes, that is correct.
There are 315
Correct.
available today, but that won't be the same tomorrow or the next day.
It doesn't, and we're working diligently to try to even increase that number higher.
Do you have a guesstimate as far as how many weeks you will continue this drive for testing?
For the foreseeable future, I believe, I'm confident that we will continue this simply because of the second peak of the first wave of the COVID virus. As we see, we're at the highest level of activity here in the county that we've had from the very beginning. So testing is an integral part of being able to protect the public, but also gives us that data we need to make wide decisions. How are we going to flatten this second curve? Next.
Are you in contact with the state at all for the possibility of expanding testing capacity even further, like in Hillsborough?
All partners are always in communication with the state and coordinating with them where we can. We're very pleased to hear recently Governor DeSantis' comments around wanting to expand testing. But at this time, this operation is limited to our partners with Baycare, the City of St. Pete, Pinellas County Government, and the Pinellas County Health Department.
Are you still having trouble getting tests? Is that the issue? Is it still tough to get these tests?
It's not the machinery itself, it's the swab that we use to collect it, and then the reagents, the chemicals that have to go through the machine itself. And we are dependent upon our suppliers and vendors to give us those. We're pulling from them the same as all healthcare systems across the United States are.
Oh, and Caroline was rapid testing, I believe. Is that what this is going to be?
No, we are not doing any rapid testing. The rapid test, it serves its purpose. However, Baycare believes in having the highest reliability of data available. This test, because the swab itself goes far into the nasal passages, it gives a very good sample for running the test. The rapid test only goes in just the opening of the nose, so not as much material collected. The tests that we run have a 95% sensitivity rate. The test that's a rapid can be somewhere between 70 and 85, depending on the studies. So Baycare has elected not to perform the rapid testing so that we can give them the best result possible. I hear. Anyone that comes up and they do not have an order from a medical provider, and they do not have symptoms or meet criteria for testing by the CDC or the Florida Department of Health. In an effort to test those people that are at the highest need, we will not be offering testing to asymptomatic people with no exposure or no other medical recommendation.
How long can people expect to wait for their results?
Currently, our test results are having a 3 to 4 day turnaround time, much better than when we went through this the first time, and we were sometimes at 7 or 10 days turnaround for testing. So far, our partners with here locally with commercial labs, nationally with commercial labs, and then Baycare has been very aggressive in building our ability to do testing internally as well. So turnaround time, 3 or 4 days currently.
Is it difficult to keep up with? I mean, we saw over the weekend 900 cases in Dallas County. We're seeing positive testing rates higher than we've seen at all. Is it difficult, or how difficult is it to keep up right now?
We are riding the wave. So far, we have had no problems meeting the demands of those that are ill, the demands of, in our hospital settings, those that are ill in our outpatient settings, and these testing programs. So far, we've had no issues.
Thank you very much.
Thank you all. Have a great day. We appreciate your support. Oh, I got one last thing. Can I get this one in? Some of you may ask what you can do to help in this time. We have to go back to the basics. We must maintain a social distancing of 6 foot between us and other people wherever possible. 6 foot is the length of a picnic table or the width of the front of your car. Number 2, hand sanitizers are great, but hand washing is much better. Soap and water, 20 minutes, front, back, in between. And then lastly, the mask. We really need to take the masking seriously. A lot of people believe that the reason we wear a mask is to protect us from getting ill. That is not true. We wear a mask to prevent other people around us from getting ill. So when you're wearing a mask, you're protecting the public. You're also protecting your loved ones, your grandparents, everyone that you care about. You're also protecting the first responders and the healthcare workers that you need here to be able to protect you. If 2 people are wearing a mask and maintaining a 6 foot distance, if one person is actually sick with COVID, the rate of transmission is less than 2% for those individuals. So it matters, it makes a difference, and we all need to be doing what we can to help support. Thank you.